But it's been pretty amazing to see, to be able to kind of live the value of actually making abortion part of healthcare and part of affordable healthcare.
That's
You know,
right.
and when I think about sort of what happens with abortion in Canada, for example, where, in general, there are some exceptions to this, but in general, people don't have to pay out of pocket for their abortion care. It is covered by provincial and territorial insurance schemes. There are some people who fall through who fall through the gaps and fall through the cracks, and there are support services for that. But it's so different to have it be integrated within a model of healthcare, and that's what we're kind of trying to do as a pilot. And
Hmm.
so we've really sort of extended our trust women and trust pregnancy capable people model to also trusting people with the money, that
Hmm.
we trust that people will afford what they can afford to pay. And for a lot of people, that's a very low amount, but they may come back and pay. We've had many patients who have paid $5, and then 2 months later they make a $5 donation and they're trying to pay it forward as well. And that's really heartening.
Mm. But that says a lot, Angel, that for many people, $25 is expensive. It
Yeah,
just tells you both the need, but also the situation people find themselves in, right?
absolutely.
It's kind of gut wrenching to hear that.
It really is. And I mean, we do routinely waive fees. So, we have people who will email us and say, I'm homeless, or I don't have a home right now. I'm living on someone's couch. I really don't, I don't have $5. Well, we don't want your last $5
Right,
either. We're very
right.
happy, but once we have that interaction with someone, we can waive those fees. Um, and I'm so struck by the people who pay more than $5, but in very sort of interesting amounts, of folks who pay $7.75. Early on, we had a patient who paid $9.22. And I understand that this is not how electronic payment platforms work, but in my mind's eye, I'm seeing this patient at her kitchen table counting out pennies. What is it that I can afford to pay? It's such a specific amount. And it's heartbreaking. It's heartbreaking that folks have to do that.
Mm.
That is a broader challenge with American healthcare, with the American healthcare system. So I'm happy to. It feels very rewarding to use this time of crisis to also forward some other values about healthcare.